This section of the DVD is to help anyone whose breast cancer has returned. If you are worried that this might happen to you, please go back to the section on emotional issues with our counsellor, who explores fears of cancer returning.
I was pretty much devastated because you think you've gone through it the first time around. And the time when I was waiting for test results and everything, Caroline had just started the mindfulness course. And I think that helped me stay sane, as sane as you can be when things are chaotic around you and your emotions are all over the place and you're trying to, I think, just see light at the end of the tunnel. But for me, the mindfulness was a lifesaver.
Hearing the news that cancer has returned can be devastating. Your emotions may be all over the place. You may be frightened about the future, or you may be facing uncertainty. It can be really helpful to talk to somebody about your concerns. This might be a member of your family, a friend, or someone in the team, perhaps the breast cancer nurse or the consultant. It may be that there's a counsellor attached to the service, or a local support group that you can join.
My response when Regan was diagnosed with cancer was obviously almost desperation. You wanted anything that could help Regan to be there for her. So any medication, so when the Haven came up, any possible course or group therapy that she could possibly take part in. And I wanted her to do everything and any drug they offered her. And for me to realise that she took charge of it and said, I want this and I don't want the other thing, which was very, very difficult for me to accept. But I think one of the steepest learning curves for me was to realise, okay, Regan is in charge of her own illness and she makes these decisions and I need to accept that and support her with that.
Your friends and family may well have the same worries and anxieties as you do, but sometimes it can be difficult to share those with those closest to us. Quite often we want to protect one another from bad news and our deepest fears. So yes, it is important to get support for them, and your breast cancer nurse should be able to help arrange this for you.
But of course, there are times when you are very frightened. There are times when I was very concerned for my son, and there are times when you wish that you were going on holiday, or you could get into diversion activities, anything, I just think, I wish I was in that person's life. This is my life, I've got to deal with it, okay. However, I think the support of people has been amazing.
You think you're the only person in the world or the only couple in the world that feels like that, and getting professional help was really, really beneficial for us.
Well, you may find that life carries on very much the same, but it may also be that you're facing some changes and some challenges, and this may lead you to think about the future and perhaps putting your affairs in order. It may be that you need to think about the impact of your diagnosis on things like your family, work issues and finances. But there are people out there who can help you do that, and your breast care nurse should be able to direct you where to go for that sort of help.
No cancer decision is easy, just by the very nature. However, once you've made a decision and you embrace the next phase of treatment, or anyone embraces the next phase of treatment, undoubtedly another journey emerges. And always, things sound so abstract sometimes, but always you're going to meet new people, you're going to make new friends, you're going to learn things about yourself.
Well, treatment very much depends on where the cancer is and where it has spread to. Medical treatment for local recurrence aims to eradicate the disease. When cancer has spread elsewhere in the body, then treatment aims to control the disease and manage the symptoms. And for this reason, treatment can continue for some time. You may decide that you want to have every treatment that's on offer and that you're prepared to put up with side effects. Or you may get to a point when you feel you've had enough of treatment and really just want to concentrate on quality of life and managing the symptoms. Really, there's no right or wrong way to approach your treatment, but it is important to discuss your wishes with the team and, where possible, involve your family. This is a common fear when cancer has returned. How long have I got to live? It's quite difficult to predict with any great accuracy because it's dependent on so many different factors: where the cancer is, where it's spread to, what sort of treatment you've had in the past. But your specialist team should be able to give you some guidelines as to what to expect. The important thing here to remember is that treatments are improving all the time, and many people continue to live long and active lives. Well, palliative care involves managing the symptoms and side effects that may result from advanced disease. They're also there to help you with the emotional reactions that may arise from the changing situation. The term palliative care or hospice can feel frightening and may conjure up feelings of hopelessness, but really they are there to help you retain control and live as actively as possible. It can be really helpful to get referred to the team early so that they can get to know you and your family and help identify your needs and perhaps respond to problems quickly rather than waiting until they arise. Complementary therapies can also be helpful for difficult symptoms and side effects, and you may find some of the techniques on this DVD and CD are helpful for you and for your family.
Definitely recommend the complementary therapies. They really do make a difference. They've made a huge difference for me, and just makes you feel good. It's just a little time for yourself away from the hospital clinical environment.